Hello, everyone. On behalf of the Spina Bifida Association staff, welcome to the Spina Bifida Association's Community Information Session, Adult Health and Aging Well with Spina Bifida. My name is Judy Thibodeau, a member of SBA staff, and I and my colleague Jessica Palmieri will be with you for tonight's presentation. This session will focus on the common health challenges that accompany aging with spina bifida, identifying the need for adults with spina bifida to take a proactive and preventative approach to healthcare management. Before we begin, a few housekeeping notes. If you have a question or comment, please feel free to use the Q&A feature at any time, and we will try to get to as many questions as possible tonight. You may also use the chat function, which we will not monitor as closely. You will receive the recording of this presentation and an evaluation survey. Please take a minute to complete the survey so that we will learn what topics are important to you for sessions like this in the future. Lastly, today's event is being recorded and we will post the video to our website soon. Our panelists for this presentation are Ms. Sara Struwe, SBA's President and CEO, Dr. Tim Brei and Dr. Brad DiCianno, SBA's Medical Directors. Welcome to Sara, Tim, and Brad. Sara?
Good evening, everyone. Thanks so much for joining us tonight. We wanted to spend this evening talking a little bit about some of the common health challenges that adults face when aging. There are more adults who live every year with spina bifida, and yet we know very little about what it takes to care for people as they age over time with spina bifida. But tonight we want to focus on the most common health challenges that we see when you're aging with spina bifida, and the things that you can do to take care of yourself in relationship to these areas. So just a little bit about statistics on what we do know about adults with spina bifida. The majority of people who live today with spina bifida are adults. Hospitalization rates of adults with spina bifida are pretty high, and about a third of those hospitalizations are really potentially preventable. And then we need providers who can understand aging versus complications of spina bifida. And tonight we have a couple of medical professionals here with us, with Tim and Brad, and they're going to spend a little bit of time sharing what those challenges are and how you can take care of yourself. But before we get started with that, I did want to just shout out to our healthcare guidelines, because they are probably the most comprehensive form of healthcare guidance that's out there on the web and is available. And it's available on our website. It's also available through our app. So I want to make sure that you're aware of that, because it has information that you and physicians can use to care for yourself. And with that, I'm going to turn it over to Brad.
Thanks, Sara. And welcome, everybody. Thanks for joining. I'm going to cover a lot of material today, so please bear with me. There's a lot of information to cover. But first, as Sara said, one thing that I want to emphasize is that there is a section of the healthcare guidelines called Health Promotion and Preventive Healthcare Services. And this will include a lot of information that I'm going to go over today, but these are guidelines that SBA has created for the medical community so that physicians and other providers are more aware of the preventive strategies, how to prevent some of these complications from happening that will prevent hospitalizations and long-term problems. And the guidelines are available as an app through the SBA website. There are also patient and family-friendly versions of the guidelines as well. Next slide. I wanted to talk about a survey that we did in my state of Pennsylvania. We surveyed primary care providers in Pennsylvania, and we asked whether their practices follow or refer to the spina bifida guidelines. And we were shocked at the results. So only 14% of the primary care providers that we surveyed said, yes, they do follow the guidelines for the care of people with spina bifida. The rest said either they weren't sure, they're not familiar with that resource, or no, they didn't follow them. So that just shows that there's quite a bit of work to do in order to improve the knowledge of primary care physicians and practices about the care of people with spina bifida. Next slide. So we're going to talk today about a lot of different reasons why adults can experience complications that can result in poor outcomes and hospitalization. And I'll mention them briefly here, but we're going to talk about each one in more detail. So these are urinary tract infections, infections related to indwelling bladder catheters, pneumonia, skin breakdown, sepsis, shunt malfunction, and even back pain. Next slide. So let's start with urinary tract infections. So it's important to understand that urinary tract infections, a true infection is when bacteria take over and infect the bladder. It doesn't mean that bacteria are just living there. For people who intermittently catheterize, when you insert a catheter in your bladder, you can introduce bacteria in there. And a lot of people have bacteria living normally in the bladder. It doesn't mean that there's necessarily an infection. But when the bacteria grow too much and take over and there is an infection, it causes inflammation and reaction in the body, and that can cause fevers, chills, pain, feeling sick. And those are the symptoms that we talk about when we're thinking about urinary tract infections. Next slide. So what can we do about urinary tract infections? Well, we know that it's really important to reduce the amount of bacteria that we're introducing into our bladder. And so it's really important to talk to your providers and your urologists about the technique that you're using for catheterization. Many people need to throw away their catheters and not reuse them. So there are sterile ways to do catheterizations. There's also things that we can do to prevent UTIs that the urologist can help you with. Hand washing is really important. This is a way that we can keep our hands clean and prevent those bacteria from getting into the bladder when we catheterize. And it's not always possible to be in a clean place when you have to catheterize. Sometimes we're out in the community, we're at restaurants, we're at work. And so if it's very hard to wash your hands in a certain situation, make sure you use hand sanitizer to clean your hands. And like I said, there are things that the urologist can do as far as recommend ways to prevent urinary tract infections. And one of those things is irrigation. Some people will insert a catheter into their bladder, attach a syringe, and flush some water into the bladder. And this is a way that you can flush it out and help reduce UTIs. And this is something that you would have to talk to your urologist about to see if it's appropriate for you. And also, using antibiotics properly is also important. And we'll talk a little bit about antibiotic resistance, when you should take antibiotics and when you shouldn't take antibiotics. Next slide. When are antibiotics appropriate? Well, remember that antibiotics treat bacterial infections, infections from bacteria.
Progress.
Antibiotics do not treat viral infections. So a lot of people want to take antibiotics whenever they feel sick. But in a lot of cases, some of the illnesses that we get are from viruses. And if that's the case, antibiotics won't actually treat that type of infection. And so we shouldn't be taking antibiotics when they're not appropriate for the type of infection that we have. And like I said, bacteria in your urine doesn't always mean that you have an infection. If you catheterize, it's normal to have some bacteria in your urine. And so it's important for physicians and other providers to test the urine to see if there's really more than just bacteria. We're looking for other things in the urine that might indicate that there is an actual infection. We're also looking for symptoms. So we never treat a lab test, we treat people. And so we only treat urinary tract infections when there are symptoms. And we're talking about symptoms of the person, not what the urine looks like or smells like. We're talking about the symptoms of the person who may not feel well, who has pain, who has fevers or chills. And also, taking antibiotics when they're not appropriate can cause side effects. People can get serious forms of diarrhea and other complications from taking too many antibiotics. And also, as a population, individuals in our population at large can also become resistant to certain antibiotics when we don't use them properly. And I want to spend a couple minutes talking about that as well. Next slide. So what is antibiotic resistance? We talk about it a lot, but not everyone understands what this means. So I like this image that helps sort of give you a visualization of how antibiotic resistance occurs. So imagine that under number one, you have bacteria in cells in the human body, and some of those bacteria are drug resistant. So they're resistant to a certain type of antibiotic. So the resistant ones are the dark colored ones, and the light colored ones are the ones that are killed off easily by that antibiotic. So under number two, the person takes an antibiotic and it kills off the ones that are sensitive to that antibiotic. So all the light colored ones have died, but the ones that are strong, that are resistant to that antibiotic, are the ones that end up surviving. So under number three, those strong bacteria that are resistant to that particular antibiotic start to multiply and grow, and they take over and they don't die because they're resistant to that antibiotic that's in your body. And then they can transfer their resistance to other bacteria. So that can also be a way that antibiotic resistance can spread. They can transfer their genes to other bacteria. So that's how taking an antibiotic might cause antibiotic resistance. And so that's why we want to only take them when they're appropriate. Next slide. There's also something called the Pasteur Act, and this is something that SBA has supported. This is an initiative to pioneer antimicrobial subscriptions to end upsurging resistance. So it's a proposal in government that, if passed, will encourage the development of new antibiotics and promote appropriate use of existing antibiotics. So this is a way that we can come up with new treatments that we haven't had before, and also educate the medical community so that antibiotics aren't prescribed when they're not needed. And the area of urinary tract infections and spina bifida is one that we really need to target. And so that's something that SBA is championing. Next slide. Another source of infection or complications in adults is pneumonia. Pneumonia is an infection in the lungs, and this may present as fevers, chills, or coughing. There's other respiratory illnesses that can present similarly, but pneumonia is a particular type of infection in the lungs. Next slide. And so what can you do about pneumonia? Well, we talk a lot about vaccines, and people are aware of vaccines for the flu and for COVID and even for RSV, but many people don't know that pneumonia also has a vaccine. And the vaccine is not something that you need to get every year. It's only indicated for certain people, and you only need to get it once or twice over your lifetime if it's indicated for you. Some people who have scoliosis or curvature of their spine that is severe enough that restricts the lung capacity may be appropriate for the pneumonia vaccine. And so that's really something that's very important to talk to your primary care doctor about, or a pulmonologist, but because everyone's case is unique, and this vaccine might be indicated for certain people. And just like with other infections, you want to prevent infections and spread to other people by washing your hands and using hand sanitizer. Next slide. So let's move on to skin breakdown. I like to think about wounds or skin breakdown from a lot of different angles, because wounds are caused by a lot of different things. Wounds are caused by pressure, which is direct force on the skin. Wounds are also caused by shear or friction, which is where there's a force across or sliding across the skin. Wounds can be caused by moisture, wounds can be caused by high temperature, and also wounds can be linked to a person's nutritional status. Next slide. So what can we do to prevent wounds? Well, it's really important to check your skin every day. If there are areas of your skin that you aren't able to see, use a mirror with a long handle. There's also a really interesting technique that I learned that can be helpful. Have somebody put latex-free stickers on your body, especially in places that might be hard to find. And then look to see if you can find all of those stickers. And if there's any that you can't find or see, then it may indicate that there's a part of your body that you're not really going to be able to see very easily on your own. And you may need to use a mirror. You may need to have someone else check for you. It gives you a sense of those hidden areas that you might miss. It's really important to use an appropriate mattress. So if somebody has a lot of skin breakdown or has had lots of wounds, talk to your physicians about whether there's an air mattress or an overlay that's made of air or gel that can be put over your mattress on your bed. Wounds also come from the feet. One of the most important things that causes wounds of the feet is your braces. Sometimes when braces aren't fitting well, they can cause wounds. So make sure that your braces are checked often and refitted often. Your body changes shape and size, especially as you age and as you get swelling in your legs or your swelling goes down, and sometimes your braces fit differently. So it's important to have those checked regularly. Also, people who use wheelchairs, the sitting surface is really important. It's really important to have a good pressure relief cushion on your wheelchair. It's also important to think about all the other surfaces that you're sitting on. So we sit in the vehicles, we sit on airplanes, we sit on toilets and toilet chairs, we sit on devices for showering. Some of those surfaces also need to be padded. So talk to your providers about whether those surfaces can be protected. And the cushion on your chair is made to be removable on purpose. So use your cushion on those other surfaces. When you're sitting in a car, on a regular car seat, sit on your wheelchair cushion. For those of you who use power seat functions on your power wheelchair, that is features that allow you to move your seat around. It's really important to use those seat functions often to shift weight. And it's really important to be educated on how to use those properly and in what sequence, because a lot of people don't use them to the extent that they're going to be able to provide enough offloading of your skin to be effective. There's two features on power wheelchairs called tilt and recline. Tilt is basically a feature that keeps your sitting angle the same, but the entire seat tilts back. So it kind of shifts your weight from your bottom to your back. And that is really good for getting pressure relief off your bottom. There's also a feature called recline. That's when the backrest opens up. So your bottom stays in one place, but your back reclines back. And that, when you use that feature by itself, it can pull on the skin or cause shear. So a lot of times we don't like people to use the recline by itself. We like them first to tilt back and then to use a recline to prevent that from pulling on the skin and causing shear wounds. And again, your physical therapists, your PM&R physicians, the folks who prescribed you your wheelchairs can give you good education on how to use the power features of your chair. Next slide. So let's talk about shear or friction. Again, this is force that happens with sliding across the skin. Where does this happen? Like I said, it can happen with recline on your wheelchair, but also it happens with braces, especially if they're too big and your foot is sliding around inside braces or shoes. It's going to get some friction and cause a wound. And then many people get shear wounds from transferring. So when you transfer out of your wheelchair onto another surface, people may not be able to lift themselves up high enough. You might graze the wheelchair tire. Also, with other types of transfers, you might experience shear if you're scooting across the floor or if you're transferring onto a bed or chair. Those are all surfaces that you might get shear wounds from. So it's really important to be able to transfer safely. There's different techniques for transferring, and your physical therapists are good, and occupational therapists are good sources for teaching you how to transfer to really prevent these wounds from happening. Next slide. let's talk about moisture. A lot of times we've got pressure and shear happening to wounds, but they're also getting wet. And that is what is really also preventing the skin from healing. It's really important to find the source of that moisture and get it under control. And one big source of moisture is the bladder, of course, with bladder incontinence. So work with your physicians, your urologists to get your incontinence under control as much as possible. Even if it's just a little incontinence, it can cause problems for the skin. There are devices and supplies that do help both males and females with continence at night. There's an external catheter that can be put on the outside for a male. And there's also a wicking system that is a battery powered system that can be used for a female that will wick the moisture away. And some adults like to use this at night to prevent the moisture from happening while they sleep. Moisture can also be coming from the bowel. So it's really important to work on your bowel program to get your incontinence of the bowel under control. Many people wear diapers and they do this or other undergarments. They do this because of incontinence, but we have to remember that some of these garments are made out of plastic, and plastic can trap moisture against your body. And so if we can reduce the number and size of undergarments that we're wearing by improving our bladder and bowel incontinence, then we may not have to wear as many undergarments, and then that can help reduce the sweating and moisture that is happening just from the garment itself. And it's important to address sweat when it happens. So as much as possible, keep your skin dry. I always recommend that people dry very well after bathing. A lot of times when people transfer from their shower chair to their wheelchair, they get their wheelchair cushion wet or they get dressed very quickly. And so that moisture stays against their skin all day because it's in their clothes. So it's really important to make sure you're nice and dry and your wheelchair is nice and dry before you go out for the rest of the day. Next slide. And then, of course, temperature can be a source of wounds, especially burns. So one thing we recommend is, as far as clothing, recommend wearing cotton or quick-drying fabrics that allow the moisture to escape, avoiding synthetic materials, and also avoiding situations where you may get a burn of the skin. So these are things like the common things that I see that cause burns are food containers and pizza boxes, especially wheelchair users who put these on their laps. So you might go over to the microwave food, put it on your lap, and then take it to the table. And usually by the time you get to the table, you could have a serious burn because many people can't feel that the burn is happening. Laptops and charging cords are big sources of burns, hair dryers, curling irons, hot packs and heating pads that we use at home or even in physical therapy. Be careful about putting them on places that you can't feel very well. And also remember that cold can cause burns. So people get frostbite. Also, there's sunburns, of course. I always recommend people wear sunscreen when possible. And people forget about some of the places that we tend to get burned when we're out in the sun. People might remember to put sunscreen on their face, for example, but you might not think to put sunscreen on your lap. So if you're wearing shorts and you're sitting out in the sun in your wheelchair, you might get sunburn on your knees, for example. So make sure that all your skin is nicely covered with sunscreen. Next slide. And nutrition, again, is a big component of wound management. So we need enough protein. We need a balanced diet full of the right nutrients and vitamins in order for our skin to be healthy and to heal itself after a wound. So when I'm thinking of treating wounds, I think about all of these things. You know, we can use all different types of wound dressings and wound gels and medical treatments, but nothing is really going to heal the wound unless we treat the underlying problem as to why the wound is actually happening. And all of these things can really help with skin healing. Next slide. Let's talk about lymphedema briefly. So lymphedema is a type of swelling that people get, usually in the legs. If you have spina bifida, you can also get lymphedema in the arms. Typically, this is after something like treatment for breast cancer. We think about 10% of adults with spina bifida get lymphedema. And early on, it's a type of edema or swelling that is pitting. Pitting means that when we press on it, it leaves a little dent. So early on, when it first starts, it might look like that. But after it progresses and it's been there for a while, it becomes non-pitting. So it feels firm. When you press on it, it feels a little hard. There's actually a French term for this called peau d'orange, which means orange skin. So if you think of what the skin of an orange looks like, it's kind of rough and hard. And that can be the sort of the texture that the skin develops after lymphedema has been there for a while. And lymphedema seems to be more common in people who are overweight, people who have had wounds in the past or cellulitis in the past, wheelchair users, and also people who have high blood pressure. Next slide. So what can you do about lymphedema? So it's important to treat lymphedema early before it gets to be too progressed, because it's harder to treat the longer that it's been going on. So you want to treat early, really any type of swelling, even if you're not sure what type of swelling it is, seek treatment early. It's important to rule out and make sure that you don't have a blood clot as an underlying cause of this swelling. And this type of swelling is treated very differently than other types of swelling. Some people get swelling in their legs for reasons because they have problems with their heart. And this is a very different type of treatment. The type of treatment that's most effective for lymphedema is lymphedema therapy. And this is something that a lot of people, even a lot of physicians, don't know about. It's a type of therapy that involves a special type of massage of the legs in order to get the fluid to move up and out, and you will eventually eliminate it through it going back into your bloodstream. You'll filter it out and you'll urinate more. And then also the legs are then wrapped with a special type of wrapping or garment. And there's even lymphedema pumps that can be used to get the swelling out of the legs. And that's the most beneficial way to treat the lymphedema. And in this case, diuretics, or what some people call water pills that just make you urinate, which are sometimes used for cardiovascular or heart types of reasons for swelling, aren't really as effective in this type of edema. Next slide. And next I want to talk about sepsis. So we've talked a lot about different sources of infection. The skin can get infected, the bladder can get infected, the lungs can get infected. And sepsis is when those infections from any of those places can spread throughout the body. And sepsis is something that can be very serious and life-threatening. So we want to stop infections before they spread too far, because then it's very difficult to treat and can be very serious. Next slide. So first and foremost, and it's important to understand the signs and symptoms of sepsis, because if you're experiencing these symptoms, it's important to get medical treatment quickly. So shivering, fever, cold, extreme pain or discomfort, clammy or sweaty skin, being confused or disoriented, shortness of breath, high heart rate, especially when several of these symptoms are happening at once. Make sure you get treatment immediately, because there could be an infection brewing. Next slide. So what can you do about sepsis? Number one, again, is just preventing those infections from happening in the first place. So we talked about how to prevent wounds. We talked about how to prevent urinary tract infections. We talked about how to prevent pneumonia. If you prevent those things, and we do a better job at that, we're going to be able to prevent sepsis from happening from those things. Practice good hygiene. Keeping yourself clean, keeping your hands clean is actually quite effective in reducing infections. Number three, knowing the symptoms, so that if you are experiencing any of those symptoms, you know to get treatment immediately. And four is acting fast. So with sepsis, it's important to get treatment fast, and that's going to be what results in the best outcomes. Next slide. Let's talk a little bit about shunt malfunction. This is something that's not necessarily as preventable as some of the other conditions we talked about, but it does happen. Thankfully, it doesn't happen in adults as much as it does in kids, but it's something that is possible and you should be aware of. So shunt malfunction can result in symptoms like headaches, nausea, vomiting, changes in your vision, fatigue, changes in your cognition or thinking. It's really important to know what type of shunt you have, because if you go to an emergency room or a neurosurgeon or some provider that isn't familiar with you, it can help them a lot for them to know what type of shunt you have, especially if it's a programmable or a non-programmable shunt. And there's a very useful app that was developed by the Hydrocephalus Association. I do recommend that my patients use it. It's a way that you can store information about your shunt. And then if you do present to an emergency room, you have that information readily available. You can even store images of your head CTs in that app. Next slide. I also want to talk about Chiari malformations. Most people who have myelomeningocele type of spina bifida have a Chiari malformation, specifically a type 2 malformation. Chiari malformations are ways that our brains are shaped, where some of the brain sits very low in the skull and some of the brain is actually in the spinal canal instead of in the skull. And this is just the way that we're born. So it's normal for a lot of people with myelomeningocele to have a Chiari malformation. But sometimes there can be too much pressure on that part of the brain in that canal. And if there's too much pressure there, you can have symptoms. And so those symptoms include headaches. This can also cause sleep apnea because part of the brain in this area is what controls your breathing, especially while you sleep. And so this can be a very important reason why some people would develop sleep apnea that a lot of people aren't aware of. Chiari malformations can also cause problems swallowing, sometimes are associated with severe acid reflux. We can also have problems with different nervous system structures that run through here. So like the nerves to the eyes, so you can develop double vision. It also affects the part of the brain that controls your balance. So you may have problems with balance or coordination because of a Chiari malformation. Next slide. And let's talk a little bit about sleep apnea in a little bit more detail. So we talk about sleep apnea as being either central or obstructive. Central means that it's coming centrally from your brain. So that would be coming from a Chiari malformation, for example, where your brain just isn't controlling your breathing correctly. But some people can also have obstructive sleep apnea. And this can happen if something's obstructing your breathing while you're sleeping. And this is the most common type of obstruction comes from being overweight or obese. It's important to treat sleep apnea because if it goes untreated, it can result in long-term heart and lung complications and poor outcomes from that. So we should not just leave sleep apnea untreated. Symptoms of sleep apnea that's untreated can be things like headaches, especially morning headaches, being tired, snoring very loudly at night, and also gasping for air. So if it sounds like you can't get enough air while you're sleeping, that can be a symptom of sleep apnea. So it's really important to get tested for sleep apnea. A sleep study can tell you whether you have it. And if you do have it, it's really important to have that treated by a pulmonologist. Next slide. Let's spend some time talking about back pain. And a lot of questions that I get is my back pain related to my spina bifida or not? People with spina bifida, of course, get back pain just like everyone else does from all the other reasons that are associated with aging. So it's really important for us to understand what could be causing back pain, how to find the right provider for the type of back pain you're having. And it's really important for us at SBA to really teach providers and educate them about the different types of back pain, especially those that affect people with spina bifida. And that's something that we're very, very passionate about doing because it's a big problem for our population. Next slide. So back pain, just in general, back pain is extremely common. And of course, back pain can be related to spina bifida. For example, people can have back pain from tethered cord syndrome, which is certainly spina bifida related. But back pain can be related to aging as well. So just the wear and tear that we all experience with our bodies. We get muscle strains, we get spinal stenosis, which is like a type of arthritis in the back. We also can have problems with our discs in our back. And so these are just examples of other sources of back pain that may not be related to spina bifida at all, but that people with spina bifida do get. So it's really important to find the cause of the back pain, because the treatments for these things are all unique. The way that we treat tethered cord syndrome, the way we treat muscle strains and spinal stenosis and disc problems, they're all very different. And so that's why it's important to see the right provider to get the right diagnosis in order to get the right treatment. Next slide. So let's talk a little bit about tethered cord syndrome. So with tethered cord syndrome, the spine in a sense is tied down. And tethered cord just means that if we do an MRI of your back, we will see that the spine is tied down. And most people with myelomeningocele, and some people even with other types like lipomyelomeningocele, have a tethered cord that we see on imaging. It doesn't necessarily mean we need to do anything about it, especially if the person isn't having any symptoms. But sometimes people do develop symptoms from this. It can happen, especially if you have some sort of accident or injury. We see some people start developing symptoms sometimes, and that's when we call it tethered cord syndrome. So the syndrome part means that it has become symptomatic. And so some red flags or things to look out for are pain, especially that's radiating down into the legs, a change in strength where you're noticing weakness in areas that were never weak before, changes in sensation where you're noticing numbness in areas that were never numb before, and also changes in the way that your bowel and bladder are functioning. So these are things that we would want to think about and see a provider for if they are occurring, because they could be associated with something that needs more workup and treatment. A syrinx is a condition where a fluid cavity appears inside the spinal canal, inside the spinal cord. And this is when that fluid develops in there, it can compress the cord from the inside out. And you can get a syrinx or a fluid-filled cavity really anywhere in your spine. We think of them happening in the neck a lot, but they also happen in the thoracic or upper part of the spine, between the neck and the lower part, or they can even happen in the lumbar part of the spine. And if people develop a syrinx, the symptoms that they might experience are somewhat similar to a tethered cord, except if the syrinx is happening in the neck, you would have symptoms in your arms. If it's happening in the trunk part, you might have symptoms around your trunk. If it's happening in the low back, you might have symptoms in your legs. And so again, we're looking for things like pain, we're looking for numbness and tingling, and we're looking for weakness in areas that were never weak before. So folks who do have a syrinx, who know you have a syrinx, it's important to have that monitored. We oftentimes have to check it with an MRI every once in a while to make sure that it's not getting larger. And so if you're experiencing any of these symptoms, it's really important to see a neurosurgeon to get proper workup and treatment. All right, let's talk about scoliosis. So scoliosis is curvature of the spine. Some people are born with scoliosis, but scoliosis can also be related to a tethered cord. So folks who have a cord that's already tethered and who go through a growth spurt, we may see scoliosis developing. So this is really common, especially during puberty and growth spurts. But scoliosis in and of itself may not be painful, but as it advances and it causes more problems, it may be painful. And because it compresses your organs in your chest, especially your lungs, it can cause problems with breathing. It can cause problems with positioning in your wheelchair. And sometimes, depending on the extent of the scoliosis, it can also cause skin breakdown. So if you do have a scoliosis, it's important to talk to your doctor about whether it needs to be monitored. That sometimes depends upon the severity. And if scoliosis is severe, like I mentioned before, it's important to see a pulmonologist, especially if we think that it could have an effect on your lungs. Next slide. Okay, one of the big initiatives we had at SBA was to create more resources for people with Spina Bifida Occulta. We've talked today a lot about myelomeningocele, lipomyelomeningocele. There are other types of occult spina bifida that affect the population to a very high degree. There's lots of people with Spina Bifida Occulta, and a lot of people have pain. So we developed a couple webinars and also this decision tree that really help you sort of navigate the system and find the right provider if you're somebody with Spina Bifida Occulta and you do have pain. So let's talk through this just a little bit. One thing to recognize is that 10 to 20% of all adults, I'm not talking about adults with spina bifida, I'm talking about all adults, have Spina Bifida Occulta. So there's actually some types of Spina Bifida Occulta that are extremely common and that don't cause any problems. And so some people are just born with some bone that hasn't formed completely in the back of your spine. But in those people, they have nothing wrong with their nervous system. The nervous system develops normally. And missing that bone does not cause any problems. It doesn't cause any pain. It's actually considered just a normal finding because lots of people have it. But back pain is also extremely common. And so it's really common for there to be people with this type of Spina Bifida Occulta. It's also really common for people to have back pain. Oftentimes that pain is happening in those same people. And in those cases, the back pain is usually not Spina Bifida related. So it may be related to spinal stenosis. It may be a problem with a disc. It may be a muscle strain. There may be lots of different causes. And the treatment for that is important to work up and diagnose properly. So usually the type of physician that would see that type of provider would be first a PM&R physician. But let's jump into the decision tree just into a little bit more detail to talk about the cases where Spina Bifida Occulta might be more complicated and there is something wrong with the nervous system. So first, we think about Spina Bifida Occulta being discovered. Oftentimes it's discovered on an x-ray. Like I said, there's some people who won't have any symptoms at all, and so those people don't need any treatment. But if those people are having back pain, this can present in a lot of different ways. So we're looking for back pain that's associated with weakness, numbness, scoliosis, change in bladder and bowel function, any skin abnormalities that would indicate maybe something was abnormal over the lower back. There might be a change in the color of the skin or a hairy patch or a dimple. If any of these kinds of symptoms are present, we recommend getting an MRI in adults. Next slide. The MRI in adults will then show us whether there's problems with the nervous system. If the spinal cord or underlying nervous system structures are abnormal, so we might see something abnormal in the spinal cord, we might see spinal tethering like a tethered cord, we might see some fatty tumors in there, fatty phylum. That indicates that the person should see a neurosurgeon. So if you get an MRI, there's problems with the nervous system, you want to see a neurosurgeon. If the spinal cord itself is normal, but there might be problems with other structures, like you might have problems just with the bone or with the discs or with the soft tissue, but not the spinal cord or nerve roots themselves, then a different type of provider would be appropriate. So that would be a PM&R doctor like myself. We call them physiatrists. There are musculoskeletal spine specialists. There are interventional spine specialists, neurologists, and pain specialists. These are all examples of different types of providers that might be able to help you if you've got a normal spinal cord, but an occult type of spina bifida, and you have chronic pain. And I did see a question pop up. I'm saying PM and R, physical medicine and rehabilitation. That's what our specialty is called. Next slide. Let's move on to shoulder and wrist problems, because these are two joints that are affected quite a bit in adults and do cause a lot of problems down the road. The shoulder is the most common site of injury in people that use crutches or wheelchairs. About 90% of people will experience shoulder pain at some point. Within the shoulder, the rotator cuff is the most common structure. The rotator cuff is actually a set of 4 tendons that attach to your upper arm bone. And that's what allows you to, what holds your upper arm bone into the socket and allows you to move your arm in different directions. And some of the things that we do cause tears of that rotator cuff, particularly one of the tendons, one of the 4 tendons especially. And if you tear your rotator cuff tendon, you might have pain, you might have weakness of your shoulder, you might have loss of range of motion of the shoulder. And so what's really important is you seek treatment for that early on. We can sometimes get that tendon to heal, especially if it's only partially torn or if it's strained. You don't want to let that problem go on for a long period of time, because the tear can become larger, which would require potentially surgery. And if you leave it untreated for a long period of time, the muscle will sort of die off and it will be really hard to repair. And you don't want to lose the function of your shoulder, because that's what allows us to do transfers. It allows us to propel our wheelchair. It allows us to use our crutches and walk. Another problem that affects the hands are numbness, problems that come from our nerves. And so symptoms that might be related to a nerve problem in the arm or hand are pain, weakness, or numbness in the hands or fingers. And it's really important to seek treatment for these early as well. I've shown in the photos here some colored parts of your hands. So if you look at your hands, the blue part on the screen indicates the area that might become numb if you have a problem with the median nerve. And that's what we commonly call carpal tunnel syndrome. The orange part, the arrow should be pointing over to the little half of the ring finger and the little finger. This is a problem with the ulnar nerve, or we call that cubital tunnel syndrome. This is actually your funny bone. So if you have a lot of pressure over what we call your funny bone is actually not a bone, it's a nerve. It runs around your elbow, and everyone has, I think, experienced hitting it and feeling a tingling sensation. A lot of people get pressure over that ulnar nerve, and it can cause numbness in those fingers and weakness of those fingers. And sometimes people get compression of their ulnar nerves from leaning their elbow on things, especially the armrests of their wheelchair. So again, it's really important to treat these early if you're experiencing these symptoms. Next slide. Let's talk about hip and other joints. There's a lot to talk about in the lower limbs. We can't cover that all in this lecture, but I do want to point out that early degeneration of joints, especially in the legs, can be common. Some people are born with dysplasia of the hips, where the hip as a ball and socket joint didn't form completely. So instead of there being a socket and a ball, the socket is a little flat and the ball is a little flat, and it doesn't form a complete joint. That can result in some early degeneration. And I also want to point out that a lot of people do not wear their braces because they feel like they can walk without them. But what I want to point out is that braces not only help us walk, they also protect our joints from degenerating. So part of the purpose of braces is to protect them against this early degeneration, against developing things like arthritis. We use braces to align the joints to keep them safe. And so even if you can walk with your braces, without your braces, it doesn't mean you should walk without your braces, because the braces may be providing some protective health of your joints. So talk to your providers about your braces if you're not sure about that. Next slide. osteoporosis is low bone density, and this is something that can occur earlier in people with spina bifida compared to other people. If you do have osteoporosis, it can increase your risk of having a fracture or a broken bone. It's really important to talk to your PCP about testing, and we're really proud that one of the newest healthcare guidelines to be developed was a guideline on bone health. So there's some consensus out there about certain things that we should be doing to prevent and treat osteoporosis, especially that we know from the literature on spinal cord injury that can be applied to spina bifida. And so there are guidelines out there that physicians can now use. Prevention of problems with bone density can involve getting enough sunlight, which helps your body produce vitamin D, or taking vitamin D supplements, or eating foods rich in vitamin D, getting enough calcium, doing some weight bearing if you're able to do that, and also strength training, especially even in the upper limbs for people who can do that. Next slide. I want to touch on high blood pressure. This is something that's really common in our population. High blood pressure is a risk factor for developing heart problems down the road, and also even stroke. We did a study in our clinic and looked at how common high blood pressure was, and we found that fewer than half of our adults had normal blood pressure. So it's extremely, extremely common. And high blood pressure may be associated with having sleep apnea, and it may be associated with other medical conditions like diabetes, kidney problems, and certainly even smoking. So smoking has a lot of negative effects for your health, but this is just one example of something that it can do to your body. Next slide. And I want to just touch on the importance of planning for the future. We have a lot of adults who are aging, who are potentially in need of help from caregivers, and those caregivers who may be parents or other family members or friends are also aging. And it's really important for adults to think about and plan for who will help take care of them. If the person who is aging may no longer be able to take care of them, you don't want to run into an urgent situation where you're suddenly without a caregiver who can help you. Likewise, we have many adults with spina bifida who are caregivers themselves, who are caring for other family members like their own parents. So it's really important to think about and plan for the future in case anyone cannot be a caregiver. That involves shared decision-making. It involves thinking about independent living, and there's experts who can guide you on developing things like financial power of attorney, medical power of attorney, things that we don't want to talk about, but it's really important as adults to think about these things. Next slide. I want to just touch on how PM&R physicians can help adults with spina bifida. I'm, of course, extremely biased. This is my specialty, but I think that we can really offer a lot to adults with spina bifida. And these are just some of the things that we're trained to treat. So we think a lot about mobility, function, and gait, musculoskeletal and joint issues, exercise and physical activity. We treat pain. We treat skin breakdown. We treat bowel and bladder problems. We treat sexual dysfunction. We can help people with self-management. We work as teams with other types of providers. So we don't focus on one part of the body or one organ system. We think of the whole person, and we work with lots of other specialists. We work closely with neuropsychology to address depression, anxiety, cognitive issues. We're trained on also providing technology like wheelchairs and braces. And so these are just some examples. So you may want to reach out to SBA to find a PM&R physician in your area if you don't have one. And this is another huge initiative that we have at SBA, is to increase the access to PM&R physicians for adults with spina bifida, especially PM&R physicians who are trained to treat people with spinal cord conditions. Next slide. And I think
I
Tim,
take
I'll pass it
over.
off to you. Yeah, thank you.
Good evening, everyone. for those of you who don't know me, I'm Tim Brei. I am the medical director of the Spina Bifida Association. I am an adult with spina bifida. I always learn a lot when Brad talks because I was trained to be a pediatrician, and so these adult issues and how to manage them are new to me, and things that I am learning to deal with in my own body and in my own life on a personal level rather than a professional level. So I appreciate Brad spending a lot of time on these issues. I want to talk a little bit about the direction that SBA has gone and that we are planning on going to, not in great detail, but I wanted to again mention the National Spina Bifida Patient Registry. This registry was started in 2018 in association between SBA and the National Center for Birth Defects and Developmental Disabilities at the CDC. And the goal of this were really multiple. One was to understand what care people were getting in clinics, because we knew that the care was variable from site to site. And we wanted to learn what kinds of outcomes people were getting so that we could look at the sites that are part of the registry who were having better outcomes in certain areas, so that we could look at how can we provide better care and better treatments to people with spina bifida. While the registry is clinic focused, which means it has a large percentage of children and adolescents, there is also a significant number of people who are receiving, significant number of adults who are receiving care, who are part of a clinic. And so we are getting information about what is happening in the questions that are being asked as part of the registry. And the goals moving forward are to continue to identify comparisons between clinics and population groups and age groups, as well as geographic areas, to look at what care is happening and what are variables that may affect care, to identify best practices and improve outcomes for care, and also to the group of clinicians and researchers who participate in the registry really help to also guide additional clinical questions and look at priorities for future spina bifida research that may be able to be done through the registry. The registry is really important because we have actually over 10,000 people, and there are currently 20 clinics across the country that are participating. We know that this is still not fully representative of everyone with spina bifida, but this is by far and away the largest registry and information gathering resource that exists anywhere in the world to look at what is happening with people with spina bifida. Next slide. Why is the registry important? Because these clinics provide data from patients with spina bifida, and we can look at different variables that may affect care. For example, we can look at demographic information. We can look at race and ethnicity information. So we can try to look at whether or not people of different race or ethnicity have different outcomes, and look at what are barriers to those outcomes being the same as for Caucasians. We can look at what treatments are being done and how many surgeries are being done at one site versus another site. We can look at outcomes of continence. We can look at outcomes of mobility. And the registry is, with the data, is really looking at describing those elements at all ages and comparing the outcomes so that we can improve clinical pathways that can be implemented across the country based on the best outcomes that are happening within the clinic, within the registry data and at those clinical sites. Next slide. As part of the guidelines for care, the people who participated in developing the guidelines, the clinicians and consumers who were part of that process, also identified over, I think, 250 gaps in care where we didn't have good research that informed care moving forward, and that our best information was based on best practices and clinical consensus. SBA then developed a methodology for looking at all of those different 250 gaps, and a shout out to Don Burrows, who worked with SBA on this, to identify which were the most important care gaps or areas of concern for parents of children with spina bifida, parents of adults with spina bifida, and adults with spina bifida themselves. And each group cited their top 5 concerns. And this slide really summarizes what those concerns were by age group. Based on this, next slide, I think. Based on this, there are 6, SBA developed the Research Advisory Council based on the 6 primary topics that came up. And SBA is continuing to work at looking at how we get research going and support research in those topic areas. So that we really have, what's important about this is that the patient voice really drove this process. And so we are trying to look at ways that we can promote research in these areas. We have leads for each of those 6 topic areas that came to the forefront, and those groups are continuing to work. So the importance of the research agenda and research moving forward is that those of us who care for people with spina bifida agree that we do not have a complete understanding of how to provide the best care, nor do we have an understanding of how that care may vary or what factors we need to consider as we age. We also need to understand that people need spina bifida informed care, and that there are gaps in providers' knowledge, particularly in adult care, in understanding how to care for people with spina bifida. We understand that there is meaningful research that needs to happen to close these gaps in understanding and to prove healthcare outcomes. And we are excited that we had the patient voice to develop the research agenda through the Spina Bifida Association. And I want to encourage you with your providers, if you identify that they are doing research, which may for adults happen through primarily academic centers at this point, that the most research proposals now, as opposed to even 5 years ago, really require a patient voice in the development of any research proposals, any theories or hypotheses that occur related to research, and an indication of how consumers with spina bifida are going to be involved with these projects. The Spina Bifida Research Agenda really is important because it was the effort of SBA to really get the patient voice involved and active, and really actually, frankly, serves as a model for other organizations because we did this much earlier than many organizations, voluntary health organizations have done. So I want to say that a significant piece of the strategic plan for the Spina Bifida Association moving forward is really continuing to focus on how we can improve care for adults, how we can improve adult outcomes, how we can prevent complications of care, and how we can better equip providers in primary care as well as even subspecialty care to provide better care for people with spina bifida and better outcomes. So care for adults is a major foundation for the strategic plan moving forward. And a big piece of where the resources for SBA are going to be involved with as we move forward with the strategic plan.
So that concludes our presentation for the evening. We have been taking copious notes of all of the questions that are either in the chat or in the Q&A. And our plan is to offer a follow-up Q&A session after the first of the year to be able to really spend time answering questions. There were some really interesting questions posed. I want to make sure that we have a chance to get the right people around the table to answer the questions for you. And if you think of other things that, other questions you have, please feel free to reach out to Juanita at the National Resource Center to let us know. We do gather that kind of information to kind of help us make determinations about future programming and also resource development. So please keep this conversation going. It's been a wonderful evening. Thank you so much for joining us.
Sara, Laura just put something in the chat, which I want to mention, is that the research agenda is actually going to be presented in much more detail in December. And so if you look at the chat, the information about that is there. SBA is advertising that, and there will be social media and everything about that. But you have advance notice to be able to sign up for that.
Yes.
And you will receive a copy of this presentation, a recording, and we will do our best to answer the questions in writing that you've provided that we couldn't answer tonight. And then, of course, an Ask the Expert session after the first of the year where you can ask questions again and more.
All right. Thank you, everyone. Thanks so much for taking time out to join us tonight.
And thanks, Sara, Tim, and Brad. Thank you.
Thank you all.
Bye.